On March 23, 2010, the United States approved the bill, the Patient Protection and Affordable Care Act, commonly referred to as Obamacare. This has led to much discussion and debate regarding healthcare and whether a more private or public healthcare system would be advantageous. With the Canadian Health Accord up for renewal in 2014, implementing more public healthcare initiatives than at present would greatly benefit Canada.
Health promotion and health prevention strategies are implemented more frequently in public-type health systems. These programs cut back on medical expenses, prevent illness, or development into more serious diseases. In contrast, a private healthcare model is set up to treat serious health problems before placing preventative measures in action. Patients are less likely to see a doctor until they feel sick because of the high cost of health insurance. The cost of private healthcare blocks health prevention strategies from being practiced by patients.
As humans, doctors make medical errors that sometimes lead to malpractice lawsuits. American physicians are protected under multiple private organizations with varying premiums. In this type of system, these organizations have different opinions on litigation and have the power to set high premiums to maximize profit. High insurance premiums indirectly encourage physicians to practice defensive medicine. This involves running more diagnostic tests than necessary in order to avoid lawsuits and resulting increased premiums. In Canada, physicians are provided mandatory insurance through one source, the Canadian Medical Protective Agency, which removes differences in litigation and premiums.
30 to 35% of young adults in America are uninsured. Moreover, the elderly struggle to pay for prescription medications because most of these are not covered by Medicare. Similarly, women in the U.S. pay twice as much for health care as men. In addition, low-income families spend more than 40% of their income on health care. On the contrary, public health care does not discriminate based on age, gender, or socioeconomic status. For example, the national health system in the UK has been shown to have more equality in healthcare services than the US or even Canada. America boasts of the best healthcare in the world, but for the nearly 50 million Americans without health insurance, this care is unattainable. Even those who have insurance are at risk of being denied coverage because the insurance companies care more about profit than they do about patients. For example, health maintenance organizations provide a bonus to the doctors that deny treatment to the largest number of patients. In contrast, a more public healthcare system ensures that everyone has equal access to the same quality of care.
Rural areas and remote Aboriginal communities have smaller population than cities. For a doctor working in an area where there is less potential patients isn't ideal. However, doctors have been given incentives to work in these rural communities. Furthermore, in private healthcare models seen in the US, individuals living in rural areas tend to have lower economic status. 1 in 5 of the 41 million uninsured Americans live in rural communities. People living in these areas cannot afford to pay for health insurance or pay out of pocket for health care.
Americans are more likely to see a specialist in less than 4 weeks compared to Canadians. However, in order to battle increasing wait times, America spends more money to hire doctors and purchase technology, which increases overall healthcare costs. Canada is taking initiative to battle long wait times, including proposing the 2004 Accord, which helps reduce wait times by reporting on 5 priority areas. Promising statistics published by Health Quality Ontario state that CT scan wait times have decreased by half compared to 3 years ago, proving that Canada is well on their way towards a solution.
To summarize, a more public healthcare system is better than private healthcare because of the increased use of health promotion and prevention. It also simplifies the system for malpractice insurance so that physicians can focus more on providing care for their patients rather than avoiding lawsuits. Finally, healthcare systems that are farther to the public side of the continuum are able to remove social inequalities in providing healthcare. With the arguments presented, what is your opinion? Do you think Canada should adopt a more private approach or move towards having a more public healthcare initiatives?